Hi, Keith Cronin here today to show you a great way that you can use your VibraCool to do common exercises that you would be using in rehab for anything that is with joint pain, post-ACL, post-total knee replacement. Commonly what you'll see happen is the quad muscle will get shut down. And so what we can do is we can use the VibraCool's oscillatory functions and that high frequency vibration to actually help activate the muscle to be used in conjunction with exercises. So, taking your VibraCool, putting it over the motor point for the quad, which is going to be right at the end, so we're going to be hitting right along the vastus medialis. And then ideally, if you do have two of them, then you can put that one up a little bit higher. And then what that's going to do is give you two different spots that you're going to be able to hit the motor point with. Again, using the VibraCool, very simple, just flip it on, okay? And what you can do is you can do a variety of different exercises, starting with something just a bit simple. So, commonly, one of the most challenging things is doing leg exercises, just doing those straight leg raises. So being able to incorporate them into your basic leg exercises to get a bit more activation of the muscle. Then as you start to progress, you can go into doing things such as lunges, working down this position, okay? From there, if you wanted to get into doing more squats, up and down, just like this. And you can see the goal of all this is to utilize the high frequency vibration to get muscle stimulation to assist with quad control. Put this into a rehabilitation exercise and it'll be one more tool in the toolbox to be able to get your patient back where they need to get to.